titled GOTV, How Voting Affects Our Health and Well-Being. And so today's conversation is going to explore an often overlooked truth, and that's that voting and civic participation are both social determinants of health. The leaders that we elect make decisions that influence access to healthcare, clean air, clean water, environmental protections, housing, transportation, and many other policies that shape the health and well-being of our communities. And so we felt it was timely as we all prepare for this upcoming August primary election that we hear from community leaders, our health professionals, about the connection between civic engagement and health equity. We'll also discuss some practical ways to have meaningful conversations with our neighbors, our friends, our family members, and our colleagues who may feel a little discouraged or disconnected from the political process. And so, whether you're a healthcare professional, an advocate, community organizer, or an engaged citizen, we hope that today's discussion leaves you informed, inspired, and empowered to use your voice and your vote to help build better, healthier, more equitable communities. And so, again, thank you all for being here. I'll give a quick introduction of myself. My name is Kareem Scales. Glad to be here with you all and help facilitate this conversation today. I am here as it relates to my role with the Cancer Free Economy Network. I serve there as the Building Power Node co-lead. And so as a part of our work related to education and outreach, we've been hosting a series of webinars and decided to partner with Michigan Clinicians for Climate Action to bring to you all this very timely and important conversation. And so we'll do introductions of our panelists and others here as we continue along. But I want to just do a little bit of housekeeping and give you all some quick information about the agenda for today. And so we'll start off with a few slides. That'll just kind of set the stage on what is social determinants of health and how it connects to our vote. From there, we will jump into and hear from our leaders, our experts in this space. And so instead of a traditional panel, we decided to switch it up a bit. And so we have 4 dynamic speakers today. We're going to give each of them a prompt, a question, and allow them to reflect on that for a few minutes. And then we'll allow others to kind of add context. And so each speaker will have a dedicated amount of time to talk about what this means for them and their work. And then we'll make sure to open it up for Q&A at the end. So there will be an opportunity for you all to ask questions. If you have any questions or thoughts or resources as we're having, as our speakers are speaking, feel free to just put those in the chat. And we will, again, as I stated, dedicate time toward the end for you all to ask other questions directly as well. And so with that, I'd like to pass it over to Teresa from Michigan Clinicians for Climate Action. She's going to introduce herself and share a little bit more background on what we're doing here today.
All right, thank you, Kareem, for that introduction. I've just shared my screen, and I think everyone should be able to see it. Let me know if you can't. But just to get started, and we are recording this, so we will be posting it online as well. And given that the primary election is in August, and then we have our general election in November, I know this isn't going to be the first and only time that we're going to be talking about civic engagement and voting. I've got my background in public health. I was previously an environmental reporter, so I wanted to start with just defining what the social determinants of health are. I'm sure most people here are already familiar with the term, but these are the non-medical factors that influence a person's health and well-being. And according to the World Health Organization, they contribute to about 30 to 50% of all your health outcomes are tied to non-medical factors. So non-genetic factors, not factors related to the actual healthcare that you receive, but these broader policy, structural issues, advantages. So breaking it down, we have, economic stability, we have education access and quality, we have healthcare access and quality, and then we have social and community context, and then the neighborhood and built environment. And I know that, as an environmental health organization, we really do focus on that built environment and that environmental quality. But as you can already kind of tell where I'm going with this, voting is a social determinant of health. It was declared so by the American Medical Association in 2022. They've put it in here under social and community context. But I think it's also worth pointing out that, as our panelists will discuss, that voting influences all of these other factors as well. Your employment, your access to healthy foods, your access to education, your access to healthcare. What kind of investments are made in your education, what kind of investments are made into your built environment. And this is just, that list continued. So even though it's kind of slotted here, civic participation, it interacts with all the other factors, other social determinants of health. So here we have, American Medical Association, when they announced voting as a social determinant of health, they also released a list of recommendations saying that it was in the interest of public health to expand access to voting. That meant increasing polling locations, that meant extending the time that people could vote, and also addressing gerrymandering as a public health issue specifically, as something that limits people's access to weigh into systems of government that structure and inform so much of people's lives. A little bit of research tracking how voting directly affects health is very difficult to do because there's a lot of, what they would call confounding variables. But generally speaking, it's recognized that the relationship between voting and health is reciprocal, that your ability to vote can be directly impacted by your own health, and then subsequently, how you vote, if you vote at all, also affects your health outcomes. And then some research that I looked into, what the actual connections and relationship between civic engagement was. Well, one, it is directly tied to your income and education level. People who are higher income, who have achieved a higher level of education, show up and vote at higher rates as well. So once again, that's influencing the other, relating to the other social determinants of health. Volunteering and voting were found to have some positive associations with your mental health and also what kind of health behaviors people engaged with. Once again, it gets really complicated when you look at, all the factors that come at play when you're talking about a person's individual health. But publicly, decreased access to voting is also associated with increased exposure to environmental hazards. And this is a self-perpetuating cycle. Access is by design. We've seen that when you're exposed to higher environmental hazards, you're also typically in a neighborhood that has been historically redlined, where voting disenfranchisement is the policy, and where you might not have access to healthy foods. You have food deserts, and you have limited economic mobility as well. So it's not a coincidence that this has happened, and we'll talk more about that throughout the discussion here, but it is a perpetuating cycle. Decreased political representation affects people's ability to vote, and as they're less represented, then that affects a plethora of issues as well. So I could get on my soapbox there, but why we're talking about this now is that this is a key midterm. We have the primary happening this following month in August, and up for re-election is going to be our governor, our attorney general, one of our 2 U.S. Senate seats, all of our 13 congressional representatives in the House, and all of our state legislators. So it's a significant election within our state, but also nationally, given the rollbacks that we've seen to environmental health protections, given the cuts to Medicaid and SNAP. It's a really important election to engage in within our state and nationally. I know there's a ton of resources about voting. I do think that if I were to share one link, it would be the Michigan Voter Information Center, that is through the Michigan Secretary of State, because you can answer any question on there about, what if you're hospitalized? How do you get a ballot? How to find your polling location? What is on your ballot? It's the like one-stop shop in Michigan, to register to vote, to find out, to change your registration as well if you need to. So that's a resource I would highly recommend looking into. And yep, thank you, Kareem, for putting that in the chat. So with that, I'm going to turn it over to Kareem, to take it away.
Thank you so much, Teresa. And now is the highlight of our webinar today, where we're going to hear from our amazing leaders who are going to share about their journey as it relates to drawing the connection between public health and our vote. And I want to start off with none other than a good friend of mine and leader here in Grand Rapids, who I've had the pleasure of working alongside for a number of years now, President Clee Jackson of the NAACP Greater Grand Rapids branch. And so I'll give a little bit of background on President Jackson, and then we'll jump into the conversation. So he's a proud native of Grand Rapids, the president of the NAACP Grand Rapids branch. After an impressive 27-year career with Blue Cross Blue Shield of Michigan, where he held a pivotal role overseeing community, civic, and local government relations across 22 counties in the West Michigan region. He recently retired. As president of the Baxter Community Center Board, he worked tirelessly to provide resources and support to underserved populations, ensuring that vital services were accessible to those in need. His role as a board member also for K-Connect, an initiative aimed at improving educational outcomes and community engagement, further illustrates his dedication to fostering collaboration and innovation in local governance. Founding member of the Climate Literacy Society in Washington, D.C., he sought to enhance cultural awareness and promote literacy on a national scale. He also has held previous positions, including past board member for Gilda's Club of Grand Rapids, which provides support for cancer patients and their families, and an advisory board member for Lake Michigan College's Catch the Dream program. Just a few of the various roles and titles that President Jackson has held. And so with that, I want to welcome a good friend and brother, President Jackson, to the stage. And before we jump into the question, just how are you feeling today, sir?
I'm feeling good. Can you guys see me?
Yeah, we
Okay,
can see you.
okay, good.
That's
Kareem, can you send I'm doing good. Can you send Marcus the link when you get a chance after we get through this via cell? Because I think he might want to join as well.
certainly. Maybe if we could too, let's pin our speaker to the screen, and I'd say let's go ahead and jump into the conversation. All right. Good stuff. So, President Jackson, I want to talk a little bit about, again, how voting affects our health and well-being, but specifically through the lens of the NAACP. And so I'd love to hear from you. Why is voting one of the most powerful tools for advancing health, equity, and justice in our communities? And the second part of that question, as president of the NAACP Greater Grand Rapids chapter, why is this election particularly important?
Well, let me first say this. So I've worked, as Kareem has said, I've worked in the healthcare industry actually my entire career. I did a stint at the Department of Health and Human Services in Washington, D.C. when I lived in D.C. For about 10 years, went to undergrad there. So worked on the Hill under Secretary Shalala, promoting and looking and researching Medicare and Medicaid stats across the country. So I did that. Then I moved over to a dental managed care company. And it was a small organization, but very financially resourced because it was a national dental managed care company. So worked on the dental side. and actually learned all of the product lines when it comes to, HMOs, PPOs, POS plans, and all of those things. And then moved back to Michigan and ended up getting an operations subsidiary of Blue Cross Blue Shield in Michigan, worked on the provider side for 10 years. And then I moved over to the community relations side, and I worked on that side for 17 years. Uh, it was very interesting. The sister who did the presentation on social determinants of health, when I started talking about social determinants of health, probably about 20 years ago, people were looking at me like I had horns growing up, because they couldn't the intersection between the social determinants on healthcare outcomes, right? So one of the things that I will say,
I think
it's
you're
not only
breaking
this
up a little.
election, it's all election. Can you hear me?
Yeah, cool.
Uh,
You broke up a bit as right as you were. I think
Let me
you were
see.
just. We can hear you now.
And then I might have to go off camera too for a better, but let me see here. Okay. Is that good?
I think so.
Okay. So fought for years to make sure everybody has, every individual, regardless of their zip code, their race, their gender, all of those things, access to affordable, efficient, and how, and to make sure that, again,
But yeah, I think you're still breaking up a bit.
that people have the best healthcare. Uh, I'm not sure what's going on here. Let's see here.
We got your camera off now. It's just the audio was.
So, okay, I may have to move through this quick. I think is that good? How that?
Let's give it
Is
one
that
more
better?
try, Clea, and then what we may do is if we still having issues, we can move on to the next panelist, and then we'll try to get a stronger connection and come back to you. But go ahead, give it one more try.
So that's kind of been my role. I've always worked in the healthcare industry, but what I was saying is that all elections are important. So the NAACP, fundamentally, we believe that healthcare is a human right. It's not a privilege reserved for those who can afford it. As I said earlier, I've fought for years to make sure that healthcare is accessible to everyone, regardless of their zip code, their race, their gender, and a variety of a number of other protected classes, because every family deserves to have. I have been saying this, high quality care. So for way too long, policy decisions, political decisions have put profits and people that for working families, seniors, and vulnerable communities to get the care they actually need. So I'll give you this, talking about why elections matter. So we know that the Obama Biden administration, I think it was 2012, 2000, then 2012, where the implementation of the Affordable Health Care Act was implemented, and there were tens of millions of people who had in that plan. And I want to say by 2024, there was probably like 45 million people who actually were on some form of way, there were
Please.
individuals, supportive of the
Yeah, I think we're still getting a lot of breakup from you, Clee.
the expansion of healthcare and accessibility of healthcare. Okay,
We're gonna
this is
let's
crazy. I
move.
was just
Let's give it a second, Clee. Maybe try to work on your connection. We're gonna move to the next speaker, and we'll save time to come back to you. All right, apologies, you all, for our technical difficulties.
okay.
Thank you, President Jackson. We're gonna shift and move
Yep.
forward to our next panelist. Excited to be here today with Dr. Asia Harris. Pleasure to be here with you of Harris Family Health. She's a board certified family medicine physician who owns and works at Harris Family Health, which is a direct primary care clinic in her hometown of Flint, Michigan. She graduated from Georgetown University School of Medicine in Washington, D.C., and completed her family medicine residency at the University of Illinois in Chicago. She's a professor at Michigan State University of College of Human Medicine, where she works as the Assistant Director of Leadership in Medicine for the Underserved and the Assistant Clerkship Director of the Family Medicine Clerkship in Flint. Her community and outreach work focuses on improving health literacy and access through her platform and helps combat health disparities through health education and advocacy initiatives. Additionally, she's the chair of the Michigan Academy of Family Physicians Advocacy Committee and was a 2024 Climate and Health Equity Fellow for the Medical Society Consortium on Climate Health. And so let's all give a warm welcome to Dr. Asia Harris. Dr. Harris, how are you feeling today?
I'm doing pretty good. I'm enjoying today and enjoying the season.
For sure, for sure. All right, let's jump right in then. As a family physician, you've seen firsthand how these factors outside the exam room shape health outcomes. And so, what we'd like to hear you talk a little bit about is why should people think of voting as a public health issue? And how do the leaders we elect influence the health and well being of our communities?
No, those are some great questions. Um, as far as the first question and how why people should think of voting as a public health issue, um, I want to pull it kind of outside of just my day to day. And when we think of like our current society and how long people live and how much access they have to like certain medicines and certain surgeries, all those things came because certain laws and policies existed decades ago. When I say, well, really, really long ago, when I say that people used to not wash their hands with soap, that was an initiative and a public health initiative that pushed for one, soap being made and all these things, but also for people to understand that bacteria existed on all these different spaces. And so the voting becomes such an important piece of our livelihood because the people that we vote for, the people we put in our legislators' offices, they contribute and influence the laws that impact our day to day. And so all these research like funding, all these medical technology things that have come about, all those things would not be here if someone didn't support it by funding it or support it by making it able to be implemented in certain communities. Because the things that we take for granted, like our medicines, like our prosthetics, like our dialysis machines, all these things wouldn't just pop out of nowhere without someone giving someone permission to put those in certain places. And so when we want to vote for people, we want to think about what choices they're going to make that are going to influence and impact our life because they literally are impacting how I practice medicine, like my medical license, the things I learned, the requirements I have, but also how patients are interacting and utilizing medicine. So Teresa earlier was talking about social determinants of health. Voting itself is a social determinant of health because of all those things that it impacts. And when we talk about the things outside of my patient room, like education, food access, people's incomes and job opportunities, their safety and the policies that impact how their roads are and the policies that impact how their community thrives and possibly doesn't thrive. All those things are impacted by our commissioners, our city council people, our mayors, our senators, our congress people. So we want those people to be supporting things that we want to support. So that way we on our day-to-day life can be valued and have a better day-to-day life. When I say in the health system, so all that stuff is outside of the health system. When I say the things that happen in the patient room and how people access the health system regarding hospitals, clinics, nonprofits that may be gap fillers when it comes to social services health, all those things are also impacted by the funding that comes from our legislators' choices, but also the decisions of what people can and cannot do. Um, Someone can't just come off the street and just say, I want to be a doctor and I can take care of you. There are laws and policies against that our legislators signed many, many decades ago. So that way we can keep our patients and our community safe. We're not just talking about the medicines that people have access to. We're also talking about the harms that they possibly can have access to that we don't want them to have access to. You can't just have someone doing a surgery that doesn't know how to do a surgery. Like I technically know how to do the idea of how to do a C-section, but there's laws against me doing a C-section on someone because I was not appropriately trained. And so every single piece of someone's life can be impacted by the choices that our legislators are making. And that's why we want people who represent us well to be in those positions. When we talk about people's privacy, the fact that, I can't just share who I saw in the clinic today with anyone. Their privacy is protected, their health is protected. When we talk about FMLA and when people get sick at work and them being able not to be, them not losing their job because someone put in a law that says all because you get sick does not mean that you lose your job. Like you're human, things happen, you have medical care. The laws that say that uh, companies have to give health insurance. A lot of people weren't giving health insurance because it was very expensive until there was a law saying if you have more than 50 people, you have to get health insurance. The ACA was a great example of like them filling a gap of the fact that unless you had Medicaid or Medicare or worked for a really, really good company, you didn't have health insurance a long time ago. And the ACA in the marketplace gave people an opportunity to get health insurance. And so I know that the choices I make when it comes to evidence-based medicines, when it comes to taking care of my patients, all of those choices are impacted by the training that I had that was required, that was vetted, that was pushed for certain reasons, depending on what medical problems we're developing, but also the communities that I'm serving and what they need in general. And so I don't want to make it sound like voting is just some like gray area thing when in reality, voting impacts every single piece of our lives. And when people should be taking their health very seriously, voting helps protect that their healthcare access. It helps give them more healthcare access. It helps prevent different outbreaks. Like right now, we have some parasite in Genesee County and in Michigan that is like everywhere and causing a lot of complications for people. And people are concerned about that. But we have all these protocols to protect people from the fact that this infection could come into their home because of certain foods that they might get exposed to. But if we didn't have a health department, if we didn't have the NDHHS, people wouldn't even possibly know that, these are these different protocols. Or if people didn't have reasons to pay attention to public health concerns, they wouldn't know that these things are protecting them. And that's why we're trying to tell them these things. And the last thing I will end on is so yes, I take care of people on a regular basis. But when I try and practice medicine, I try and practice evidence-based medicine. That evidence-based medicine, those research projects, those research trials, all those things are supported by people who wanted some change. They asked a really good question, but also from funding that is supporting the research that exists. And so modern medicine wouldn't be what it is without the support of different policymakers and different lawmakers saying we should have a better health outcomes, that we should close these health disparity gaps, that we should have better health equity initiatives, so that way people could live longer and healthier lives. And so quality of life is really important. Life expectancy is really important. People having access to regular care is really important. And all those things wouldn't exist unless we made it a norm and we made it an intentional move to consistently provide good access, provide good quality care, and prevent and protect patients from harmful things. And those things are implemented and regulated and enforced by the laws and policies that exist because we vote for people to create those laws and policies and listen to our voices. That's it.
No, well said, Dr. Harris. I think you hit on so many levels, and I think it's back to where we started off the conversation. It's just so timely considering where we are in our current political landscape, right? Where we're experiencing some of the most historical rollbacks that I'm sure we could in our lifetime for sure. And so just appreciate you for for sharing those insights. I just agree with everything you said and love everything you touched on.
No, thank you.
Before we move on, I wanted to just give it just, if we can, just really briefly, if any of our other panelists had any just quick reflections to anything that Dr. Harris covered, please feel free to jump in now.
I think it would just be really cool to see a timeline of kind of all the policies and regulations that we have had from like the beginning of time until now. We have policies and regulations now, but I'm like, I'm sure like in Egypt, it was like, can just anybody kind of just pull out a tooth or, do whatever. So I just think it'd be a fun project. And I hadn't really thought about it that way until you mentioned it, that like I know I can't perform open heart surgery. And not just because of ability, right? Like there's these other kind of obstacles in place for good reason.
Yeah, no, there's a lot of things that have helped us live longer because people had a lot of complications, a lot of health problems back in the day, and all those have been diminished. Not all, there's still some room to grow, but because people created initiatives and created policies to help improve our health outcomes because there are things that were preventable. So it's been a great progress so far. We have more to do.
Much more to go. Much more to go. All right. Thank you again, Dr. Harris. I see some
Vaccines.
activity in the chat as well. Vaccines for sure.
Great
You think
policy.
about the role of the National Institute of Health and all these various departments. Oh, go ahead, Dr.
I do want to say one thing about the vaccines. I think in our current society, people don't quite appreciate the power and beauty of vaccines and what they've been able to diminish. Like we have outbreaks every once in a while because people aren't vaccinated. But one of the things I like to continually tell people is if you look at the children right now, majority of them never get chickenpox. And that is because in the 90s, they had the chickenpox vaccine. I personally had chickenpox. I was a little bit late on the opportunity, but a lot of my counterparts and younger don't have vaccine related or chickenpox related experiences because they were vaccinated. But when we think about polio, when we think about meningitis stuff, like people just think those infections don't exist. But when you think about chickenpox, like that is half the people alive right now experience chickenpox, and half the people are not, less than half the people are not experiencing because they're younger. And that's one of the powers of that vaccine. But now with what's going on and people's belief in vaccine, there's kind of a little teeter in the effectiveness in getting people to be vaccinated. But the chickenpox vaccine is the one thing that current people can definitely recognize that they don't see anymore. Like if you're young, 100%. You don't have it.
Yep. I have several children. I don't think any of mine have had it, but everybody had it when we grew up. At least, everybody had it at least once. HPV in the chat as well is another one. So good dialogue, you all. I want to again thank you, Dr. Harris. We'll have time for you to share some more insights as well, but for the sake of time, I'd like to move us along to our next speaker. And with that, I'd like to welcome Mary Jacqueline Mully. She's the founder of the Climate Justice Nurse and a practical care nurse at Michigan Medicine in Ann Arbor. Originally from Nairobi, Kenya, she has resided in Detroit, Michigan for more than 2 decades. An alumna of the University of Detroit Mercy and a Rebuild Detroit Scholar, an NIH-funded initiative designed to expand research participation among underrepresented populations. Her professional and scholarly work centers on advancing health equity in Detroit within the context of the climate crisis. She will commence her doctoral studies at the University of Cincinnati's College of Nursing in the fall of 2026, where she intends to further investigate the intersection of climate change, environmental justice, and community health. Beyond her clinical and academic pursuits, Mully remains active and engaged in community-based initiatives, including volunteer service, the mentorship of emerging leaders, and other cross-cultural exploration through travel and immersion. And so with that, I'd like to welcome Ms. Mary Jacqueline to the conversation. How are you feeling today?
I feel fantastic. How is everybody doing?
Doing pretty good.
Good.
I'm super excited to hear from you as someone who is an avid advocate for environmental and climate justice. Really excited to hear your thoughts and insights and draw the connection between civic health and environmental justice and climate change. And so with that, let's just jump right in.
Perfect.
Let's do it. All
Thank you
right.
so
So
much. Yeah, thank you so
yes,
much for sharing this space with us.
no, my pleasure. Thank you for taking out the time to be with us
Mhm.
this evening. All right. So, our question for you, as a critical care nurse, and as stated earlier, as a founder of Climate Justice Nurse, you dedicated your work to exploring the connection between climate change, environmental justice, and public health. And so, could you share about why should communities view voting as a critical tool for protecting both the environment and community health? And how can civic engagement help create healthier, more resilient neighborhoods?
That's a great question. So I strongly believe that the intersection of politics and a healthy community is voting. Um, Ensuring that the people who represent our communities are homegrown. They know the issues that are in our communities, and so that they can appropriately represent our communities. Voting is a critical tool for protecting the environment and community health because when, like Dr. Aisha Harris said, every aspect of the work that I do is encompassed in some type of legislature, right? And so when we understand this, we then know that having a voice, having a seat at the table is what gives us a little bit of leverage to be able to say what our issues are, explore what the solutions are, and also influence the solutions that come from higher than us. We typically try to vote. I typically encourage my patients. A lot of times when I see patients in the hospital, they come to the hospital. We care for them. They feel better, and then we send them home. But when we send them home, we're sending them back to the environments where they got sick, right? So, for instance, in Detroit, we had a lot of because of the flooding disasters that we've had over the last 10 years. Our homes have a multitude of issues, including water intrusion, mold, spores growing in our homes, infecting patients who are already compromised. And so having these conversations with my patients about, sending them back to homes their homes, which typically may have made them sick, and encouraging them to vote because how we vote is how we live. So for instance, in the city of Detroit, when we had all these flooding disasters and we started to advocate for remediation, it was difficult for people to understand why it was important until I said, okay, so the climate has shifted and there's water in our basements, and it's not only affecting our homes, but it's also affecting our health. And when you include the health aspect into anything, if you tell somebody that the sky is falling, they'll believe you. But if you say the sky is falling and it's going to kill you, then they will act, right? And so ensuring that ensuring that we're encouraging our community members to voice their opinions about what was happening to their homes, speak truth to power about what was happening in their homes. A lot of times there are many people who didn't want to speak to the things that were happening in their homes because mold is nasty, and it is very there is a stigma that comes with mold and dirty homes, and so people didn't want to talk about it. But unless we spoke of it, then we're not going to get any help. And so I just decided to be a leader in the space and go to a community meeting and tell during a city council meeting, I raised my hand and I said, my name is Mary Jacqueline. I am a registered nurse. I live in Detroit. I take very good care of my home, but I have mold in my basement. I have mold in my closets. I have mold everywhere. And it empowered people to start speaking up. And from those conversations, we started to apply pressure to the elected officials who are supposed to represent us to take care of our communities better. To give an example, when I started advocating with the Detroit Area Disaster Recovery Group about mold in our homes, we were able to advocate for backflow valves for our community so that we were not getting the the sewer backups in our homes. And it actually has worked because even though a very small percentage of homes in Detroit have backflow valves, A lot of them, for instance, in my community where we were not going to qualify for the backfill valves because of the median income, were able to advocate for our community to also get some of the help that everybody else was getting. And this is because we hold our elected officials accountable. We show up, we vote, and we speak truth to power. So, yeah, I think that civic engagement is a responsibility, but it's everybody's responsibility. However, we have to also be very intentional in how we are engaging with our communities. Detroit has, like Teresa was talking about, social determinants of health, and one of them being enrollment in higher education. In Detroit, I think there, from the community health assessment from 2025 from Mary Sheffield's office, less than 15% of Detroiters have higher education. And so when we engage when we do civic engagement in our communities, we have to be very intentional in making sure that the people that we're speaking to actually understand. And so empowering and supporting grassroots movements within the community to be able to reach these people, because they know the tribal language, they speak the tribal language, and the community, they have some buy-in in the community's trust. So when we do civic engagement, we always try to let the leaders in the community lead the conversations, and then we can support however we can best.
Well said, Mary Jacqueline. It's so much of what you said resonates with me. Literally, you said something earlier that the climate has shifted, right?
Absolutely.
I think that is accurate figuratively and literally, right? When we look at
Absolutely.
a perfect example last week, right, with the major heat that we've experienced here in Michigan, and
Yeah.
the impacts, the disproportionate impacts that we're seeing across our communities. I'm no doctor or a trained medical professional, but one thing that I always like to do when we're talking with folks and providing education about environmental justice is just, I usually will do a survey of the room and ask folks, how many people here are either have asthma or have had a family member who has asthma? And literally, usually somewhere between 70 and 90% of the room raises their hand. And then I follow up with how many of us have been told that the sole reason why we've had asthma is because it's hereditary, right? I know we grew up and most folks would just tell us that just runs in the family. And so through our work, we've learned that's not necessarily 100% the truth, and that it's a
Absolutely.
direct reflection of the communities that we live in. And I think it was brought up earlier when Teresa spoke to redlining and the impact on air quality, et cetera. So just really appreciate everything that you shared, and want to just create space for any of our other speakers to do any quick reflections as it relates to anything that Mary Jacqueline shared.
I'd like to add something about the asthma issue. So right now,
Yeah.
I'm currently a fellow for the Alliance of Nurses for Healthy Environments. I'm doing a fellowship where I am doing a clean air allies project, where I decided to empower the kids, talk to kids about clean air, especially because it's summer. They're going to be outside a lot. They're not going to be in school where they're being monitored. And so I started doing this work, and my very first workshop was on June the 1st, and I had a group of 19 kids between the ages of 9 and 11. And I asked them, how many of you know what asthma is or know a family member with asthma? And I think out of 19 kids, 17 kids raised their hands. And out of those, there was 3 who knew a child who had died from asthma. And this is a very small group. This was a very small group of kids. And so when we talk about redlining and how that affects our communities, and how we are in Detroit, we're so desensitized. The Asthma and Allergy Foundation of America has voted Detroit as the most difficult place to live in if you have asthma. This is the 3rd year in a row. Detroit is not a big city, but because we continue to hold on to practices that are century old, where we have huge factories in the middle of our communities. We have trucks that drive through our communities day and night. We don't have we have poor air quality, the Canadian smoke, but for the most part, we're not holding the biggest polluters. We're not holding them accountable because we will blame everything else, and we will teach the kids how to live, in these environments. And I do understand that adaptation is very important, but getting to the root cause of the problem and solving that root cause is a bigger has a bigger bang for the buck. So for me, in as much as it breaks my heart to hear kids tell me that they have cousins who died at the age of 7 of asthma. An 11-year-old or a 9-year-old knowing somebody who has died from asthma at that age means that they're going to experience this multiple times if we do not change the way we vote, if we do not change the way our policies are being written. Every time we have a poor air quality indexes in the city of Detroit, because, say for instance, a factory's emissions have gone haywire, these factories are slapped with fines that they can pay, because that is within the law for them to be able to do that. So it is important for us to be able to vote for people who will change the policies and change the laws so that these players can be held accountable. Asthma is a huge problem in the city of Detroit right now, and has been for a long time. I do remember when my youngest daughter is 29 years old, and I remember when Gabby started carrying a purse. It was because all the kids at church had purses, and they all had inhalers in their purses. It wasn't because of fashion. It was because that they had to keep track of their inhalers, and we didn't think much of it at the time. But right now, as the time goes on, then you do realize that the reason why these kids, we literally changed their wardrobes because of something that, something that they were experiencing. They all had inhalers, and it was like a lollipop. Every kid had an inhaler. And I do remember an era where it was unusual to see a kid without an inhaler. And so, and now these kids are adults. So if we don't start teaching the kids and protecting the kids who are 9 and 11 years old right now, by the time they're 30, we'll still be talking about the same story about how they also had inhalers and had kids who are dying in their classrooms because of asthma.
100%. I see several comments in the chat. What we're seeing from our current administration at the EPA level to weaken truck standards, everything from the coal and ash rollbacks to the endangerment findings. It feels like every day they are rolling back protections that have a direct impact on our health and disproportionately impact Black, Brown, and underserved communities.
Absolutely.
So just really appreciate this conversation. For what I'd like to do is, for the sake of time, I'd like to see, if possible, if we can, before we move on to our final speaker, Ms. Nancy Morales, and Kent County Commissioner, I wanted to see if we can try to re-engage our good friend and brother, President Jackson. I know that he had some connection issues earlier in the call. And so if you are available and if your connection is better, President Jackson, I want to see if we can maybe go back to you to share some insights on why now? Well, what's different this time around, and what can we do to encourage folks in our communities to really understand what's at stake?
Yeah, can you so I'm on my phone. I'm gonna stay off camera, and I think this might be a better connection.
I think so.
So gremlins are in my phone, or in the IT system here or whatever. But one of the things I want to first say real quick, and I'm going to be really, really quick. Dr. Harris, I want to thank you for your tireless service and your commitment to making sure that folks receive the highest quality of care possible. The other thing I want to say, in listening to the comments, is my sister, Mary Jacqueline, when you talked about having a seat at the table. Yes, that is absolutely important. It's absolutely necessary. The other thing I want to add to that is that it's not just about having a seat at the table. It's about having a position of power. at that table as well when we are actually driving legislative change and, if necessary, litigating in the courts against some of these horrific things that are happening. And so I'll go back real quickly to the Trump administration. So the Trump administration, I'm sure all of you know, preaching to the choir, was and has been widely criticized for weakening the Affordable Care Act and supporting policies that created more uncertainty. It's just a fact. And higher costs and less stability in health insurance markets across the board. And so when healthcare becomes less affordable, who's impacted the most? Disproportionately, Black communities and other historically underserved communities. And I'm talking about Black, brown, and low wealth and poor white folks. So when we look at all of these threats to do rollbacks on a lot of levels, including the EPA and what this fool who's currently serving as the Department of Health and Human Services Secretary, it just threatens so many things, and especially people that have pre-existing conditions and limited access to preventable care. So that's why it's important to vote. That's why it's important to vote. If you all remember, so we went through COVID. We went through a massive pandemic where we lost millions of lives. People died. And it was because we had a governor in the office in the state of Michigan, Governor Whitmer, who said, we're going to shut things down. We're going to put in place practices and procedures to protect Michiganders, right? And we also had another sister who was right there by her side, Dr. Mona Hanna, who was leading the research and keeping us informed and all of these things. And I guarantee you, if we had not had, again, that's why elections matter, especially at the local level and the state level, because then at the state and the local level, we can put some guardrails in place to prevent some of the damage that will roll downhill from the U.S. congressional level, right? And so that's really what it's about. The NAACP, we really believe, and I believe personally, I've been in healthcare my entire career. It is a basic civil rights issue, hands down, period. And so that's the connection between why we need to make sure that we have the right people in place, in office, and be very intentional in terms of participating in all elections. It's just not about this election. I'm talking about every election, every single election, moving into 2028, where midterms is really here. We got primaries coming up. We got the general election coming up. It is critically important that we engage in every election because it definitely has a direct impact on not only health equity, economic instability, we didn't even talk about the connection between public safety and health. And so all of those things, so that's why it's important. So I will be quiet and apologize for my janky internet connection.
No apologies needed, President Jackson. We appreciate you for just taking out the time and being a part of this very important conversation. And glad that you brought up, I think a lot of us many folks, I think, begin to forget about where we were just a few years ago, right? In terms of the pandemic and what we saw there in terms of the disproportionate impact and how the role of different elected officials played with every state playing by their own rules and how that impacted the quality of health for the residents in those states. And so appreciate you for just, being flexible and being able to participate and just really grateful for those insights you shared. Anybody else, any of our other speakers have any just quick reflections as it relates to anything that President Jackson shared before we move on?
think that it's a great natural transition. The point about, not only showing up to the table, but and not only having a seat at it, but having a position of power. Because one of the adage about, if you're not at the table, you're on the menu, I think really rings true. But if you're at the table and no one's listening to you, that doesn't mean too much either. So I think that bringing in Nancy here to talk about, what got you inspired and involved in actually engaging in the political process as an elected official.
100%. Well, let's do that. Let's welcome our next and final panelist for today. Would like to welcome Nancy Morales, a Kent County Commissioner. Uh, uh, she's a lifelong artist and tree hugger, self-proclaimed, currently serving as a Kent County primarily as a climate justice organizer. And she views her role as a recently elected county commissioner as an unofficial extension of her advocacy work. Her passion for people and planet have allowed her to work with many coalitions in a variety of roles and with many admirable advocates and activists. She's been living and loving in West Michigan since 2016, currently lives in Wyoming. And with that, I'm pleased to introduce and welcome Miss Nancy Morales. Nancy, how are you feeling today?
A little funny that you call me Miss for the first time.
Well,
But
I had to
other than that, pretty
formalize it
good.
a bit.
Yeah, it's cool. It's cool.
Okay.
Well,
Well,
hi.
glad to have you here, a part of the conversation with us. I know that uh, this is very important and near and dear to you as someone who started off your journey in advocacy and now as an elected official here in Kent County. And so, uh, want to be able to hear more from you. I'm going to pose a question to you, and please just share whatever you're feeling. So, again, as a longtime climate justice organizer and now a Kent County Commissioner, first, I want to ask you what inspired you to run for public office? And then from there, how has serving on the inside changed your perspective on why voting is only the beginning of civic engagement and why it's so important for people to stay engaged long after Election Day?
Sure thing. So the reason Well, I'll start off with a little bit of kind of my journey. So as Kareem mentioned, I have been a lifelong artist. I actually went to art school for about 9 years. So I had a very non-traditional path into politics. Um, but it felt like every stage, I think, in like my career kind of was sort of leading me towards that. And what I mean by that is that, when before I started doing my climate justice organizing work, I was working at the public library. And that was like during like the peak of COVID. So there was just like a lot of this. I was working kind of at that intersection of this like public health crisis within kind of this like more, kind of like boots on the ground level of like the library is kind of part of the government system in a certain way. So we're handing out masks, we're handing out the COVID tests, helping people out with like making appointments, yada yada. And I think that was sort of my first dabbling into just really seeing how government can react to a crisis like that and seeing what that looks like on the ground. Um, and I think it was also one of my first ways of being able to really connect with community in a different way where I was listening to problems all the time. Like, people go to the library and then, people do go in to like check books out, and, a lot of them go in for fun. But you also get a lot of folks that are like, I got locked out of my email account, or like, I can't access my social security, or I can't make this doctor's appointment. So it's just like, you really get to see kind of like what sort of issues people face day to day when it comes to access to a lot of things. Um, from there, that's sort of where I met Sergio, who's my current boss at the Urban Core Collective, and he brought me on as a climate justice organizer. At the time, I was brand new, so he was like, "Oh, you're going to be an organizer." I was like, "Cool. What am I going to be organizing?" Just like very, very, very green. But through his leadership and guidance, and just kind of like the environment of the workplace that UCC is, I really started to really look more. I think before my gaze was kind of really just kind of like at eye level with kind of everybody around me in community. But working at UCC really made me start to kind of like gaze like upward in the sense of like what systems are we living under. and really looking up, I think, and seeing how much could be changed. And I, I think it broke my brain a little bit that like policy doesn't always follow science, and that why, and I think especially as we see like through health and stuff, and climate change especially, um, I did get a little bit frustrated that a lot of the folks making these decisions that affect our day-to-day lives were seemingly clueless about, global warming and pollution and all of these things that affect us on a day-to-day basis. And it got to the point where I was like, instead of talking to them and trying to convince them, like, I'll just be there. And, you know, I think it'll just make it easier. Kind of like cutting out the middleman, I thought. So I ran for office, and thankfully got elected. Yay. And since then, I think it's been really great. Again, as kind of Corey mentioned, like using my platform as sort of extension of my advocacy work or as an amplifier of that. Because, now that I have like commissioner in front of my name, people care, like my opinion holds a little bit more weight, and my advocacy carries a little bit more weight as a result. So it's been a really nice boost in that way. But a few things that I kind of wanted to share as well is that just a couple of different thoughts that I have in my notes here are, for example, who's in power affects who feels safe. And I think this administration is a really good illustration of that. We know that a lot of folks don't feel safe because of this administration, whether it's because of their health or their status or what they look like, how much melanin we happen to have, things like that. And ultimately, the leaders that we have impact health and elections. And that goes all the way from the top, when you look at, JFK's like, Make America Healthy Again plan. And how does that trickle down to county departments and their health departments? And, what kind of information is being shared with residents? What kind of like preventative measures are being taken when certain outbreaks are coming about? I just got an email today about one called like cordyceps. Dr. Harris, do you know which one that is that's kind of going around right now, like a
It's
foodborne
like
illness one?
cycloporiasis or something like that.
Yeah, that.
It's a
And
parasitic infection.
that one right there. And I learned about that one through the health department's newsletter, Thank you. Um, so, again, that who's in charge, it kind of really dictates what kind of information is reaching residents, and then residents can then be informed or not informed on certain things. But then if you have somebody that's, a denier about certain things or an anti-vaxxer or somebody that kind of blocks certain aspects of care, then that starts to look really different for folks on the ground. And I think a lot of people are also a little bit scared about being a politician because they feel like, oh, you have to fit a certain mold. But I mean, I'm kind of a punk rock kid, like I just kind of come in with like very like authentically, and ultimately you get to like decide who like what kind of politician you want to be. And I say that because I think a lot of the folks here, whether you're on the call now or if you're watching this webinar later, you probably have a pretty good moral compass and you're probably an expert in whatever issue you tend to be focused at. And consider it an option. Consider voting to be like, kind of like entry level first step. If you feel like running for like a big elected position feels scary, there's actually something called a precinct captain where you just sort of get elected for your voting precinct. And like your job is to just sort of like to help mobilize your neighbors to get out to the polls. And if you're already doing that, and just do it with like, a little bit more power. And I think precinct captains get to go to like party conventions and such too. So that could be cool if you're into that. Um, you can get involved at your school board level, you can get involved at your city level, you can get involved at the county level. Like it doesn't have to be really big and scary. And a lot of times it could be something that's complementary to the work that you're doing, or that the work that you're doing influence that and vice versa. So I would encourage you to consider that. Um, I also want to just share a little bit about just kind of going back to what inspired me to run. And I'm unmedicated ADHD, so I will be bouncing around a lot. Um, but another part that really inspired me to run is also one of the neighborhoods that I did a lot of work in, which is the Roosevelt Park neighborhood in Grand Rapids. So it's a low-income neighborhood, very black and brown, heavy immigrant population, immigrants from all over, South America, Africa, you name it. And it's beautiful. I love it there. But unfortunately, it's incredibly underinvested in. Um, there's so much. It's actually, I think, like it has, I think, the worst air pollution in the entire city. So, and that's because of something called cumulative impact. So there's a highway right by the neighborhood. So like there's always like these giant 18-wheeler trucks just kind of barreling through. In their backyard, just like less than a mile away, there's a giant trash incinerator, like a waste to energy plant. Which while it is operating under permit levels, it's also like another, even if it's just like a little bit, like that little bit is added onto, the trash incinerator, the trucks, the highway, the like legacy pollution that's there, the heat waves, the lack of tree cover, like all of these things together create cumulative impact that really, really has a effect on people's health. And Kareem, it really resonated with me when you said that so many of these issues are just kind of chalked up to be like, oh, like that's always been in the family. And, for folks that have, there's a lot of like kind of like multi-generational families that live in the neighborhood. And for folks like that, what if they chalk up to that being just something that runs in the family? And that I think allows it to become normalized and allows it to become something that people feel like because it just runs in the family, then I can't speak out about these sources of pollution. Or maybe they don't know that it's because of the pollution. They, sometimes just those dots don't really get connected when something is so normalized for you. That's what that's what you grew up in. That's all you know. Um, and I think it prevents people from really advocating for themselves, either both in and out of the doctor's office, right? Like if you're going to the doctor for this issue and you think that it's always running in the family, so you're not really calling attention to it when you're visiting your doctor. Or also even if you're, kind of just trying to figure out civic engagement, or maybe you're not civically engaged, but you don't think it's an issue to take to your local elected because you think it's part of your family history and it's something normal for you. So Kareem, that when you said it, that really struck with me. And then like another connection that I kind of made again to sort of this neighborhood and something that Mary Jacqueline said too is also, we can provide care for these folks inside, doctors' offices, um, maybe just like any sort of like professional care, but then they're going home and their neighborhood is where they're getting sick. Their houses is making them sick. A lot of, again, as I mentioned, that neighborhood is very low income. So a lot of that housing stock is also really old, which means there's like lead, there's like asbestos, and there's all kinds of crazy stuff. And that's not to mention like legacy pollution from a company there that just leaked out a bunch of PFAS into the soil and then that volatilizes in people's basements. Yay. Uh, yeah. Anyway, so it creates a bunch of these just like a lasagna of issues for folks that becomes really difficult to really dissect and address with a very simple like with there's no like straightforward solution to a lot of those things. Um, and things also even things like remediation, like that kind of is also up to regulation and policy. A lot of the PFAS in the neighborhood hasn't been regulated because those companies haven't been accountable because elected officials haven't pursued that hard enough, right? So again, just I think as it has been iterated over and over again on this call, policy impacts people more than you know, and just because like the people that you vote for, like, it's nice that you vote for them, but try to maintain sort of like that thread of connection. Try to maintain a little bit of that pressure. Because when you're voting for somebody, you're like trusting them to make decisions on your behalf. It's basically what you're doing. So if you are going to be trusting somebody, make sure you're talking with them. Make sure you know that they do know what your issues you're facing. Make sure that they do know, what your neighborhood struggle with. If you have neighbors that don't or can't vote, you could be their advocate, and talk on their behalf. Um, and especially think a lot about seniors. A lot of them sometimes like, are just unable to leave their homes. So they're kind of like stranded. And, if they're your neighbors, like check up on them, please. But just be an advocate for those who can't advocate for themselves. If you're gonna trust somebody to make decisions for you, make sure that you're informing them on how you want them to decide for you. And just keep those lines of communication open. And yeah, I would say that's pretty much it. Run for office. I'll leave on that note.
There we go. Thank you so much, Commissioner Morales. I've had the pleasure of knowing you for several years now and being in community, organizing, advocating. And so I just want to say I commend you for your bravery and your audacity to take it to the next step, right? And I think the community feels a little safer, to your point earlier, knowing that someone like you is in office, who's not just there for various political aspirations or personal gain, but I think we all would agree, really, there for the right reasons to improve the health and well being and overall livelihood of our communities. And so, not everybody has the courage to step into those seats, and I think the impact of you taking that leap is going to be for generations to come, right? And the way that you've approached it, like not, a little bit non-traditional, right? Maybe not fitting the traditional mold of what most folks expect for an elected official to look like and dress like. But I think you bring a little bit of style and flair to politics, which is typically boring. And so that's my personal opinion, but I just resonate with a lot of what you shared and really appreciate you for the work that you're doing. And that is, we were just about to go there. I see President Jackson is jumping off mute. We were going to get into some questions for all of our panelists, but I'll kick it over to President Jackson if you have a question for Commissioner Morales.
So I just want to say I have to jump off because we actually it's interesting. I have to jump on a national healthcare call with the national office and their team. That's actually started at 7. But I just want to thank everybody for participating. These conversations are so critically important. I want to thank our sister Commissioner Nancy Morales for again, not only having a seat at the table, but making sure that we are put in positions of power, and that we understand the impact of implementing policy, I should say legislating and litigating, right? Because these things are critically important. And we all have a piece, and I will say what we say in the NAACP, as we are approaching August 4th and then the general election into 2028, I would challenge everybody to take at least 5 people to the polls to vote. And the most important thing is, we can talk all day, all night, but we also have to understand that we have to give people a reason to go to the polls. And these are the type of conversations that we have to have, and we have to be intentional of the direct impact personally on people, because there are people that will say, "I haven't seen a change in my life." Even when the Obama and Biden administration, my circumstance, my conditions have not changed, right? But I think we have to really give real life experiences and listen. And what we're doing from an NAACP perspective, I believe on August 1st, we'll send this out. I'll send it to Kareem. It's going to be a virtual listening session in town hall where we want to hear from the people in terms of what is causing you, whether it's voter apathy or why have you clocked out, and we can provide some level of education humbly, and also talk about the real impacts of this. Because as a mentor of mine has said, Dr. Reverend Wendell Anthony, who serves as the president of the Detroit branch, NAACP branch, and a national board member, he told me a long time ago, he said, "Brother Jackson, there is enough hell out here for all of us not to be competing against each other. And if all of us can just take a little piece of that hell and focus on resolutions, we'll be better off." So I'm going to leave that with you all tonight. Thank you for jumping on. Thank you for taking time. out of your schedule. So peace and power.
Thank you so much, President Jackson. We appreciate you for sharing space with us this evening and for your insights and expertise. And so with that, you all, we have just about 10 minutes left, where now is the time where we want to open it up for questions for any of our panelists. And so with that, please just come off mute or use the chat function if you prefer to if you have any questions or any just thoughts or reflections for anything that was shared today.
Hello, can you hear me?
Yes.
This is Gertrude Kroon. Can you hear me?
Yes, we can hear you well.
Okay, good. The comment I want to make based on what Commissioner Morales said in her last statement about people going to help in the with the older citizens, because very often they don't have a way of getting out and making it known to the powers that be that they need help in terms of the kinds of things that are affecting them. And I think as we organize young people, very often we organize them around the more popular issues. I think sometimes we need to organize them, because remember, the older people have the highest voter participation, and they will participate. They will vote. They might vote absentee voting, but they will vote. And I think if we organize, I've been a political organizer and voter registration for a number of years. And I know, and I'm an older citizen as well. And I know that they are very appreciative when you come to them and say, this is what I know the issues are, and this is what we're going to help you with. And we send younger people out to do that, and they have been very receptive to them. So I think that idea about how we, with the issues of pollution, whatever, very often the older Americans might not get out to have that known, but if we go to them, it will be known.
Well said. Thank you, Ms. Kroon, for bringing that into the conversation. I appreciate that a lot. I think a lot of times the emphasis is on youth engagement and not enough focus on our senior and elderly population as it relates to getting out to vote. So appreciate you for sharing that.
Okay, thank you.
Yeah,
Thank
I
you.
think another note I'll add to that is that I feel like a lot of youth are very, or at least from the youth that I'm been kind of exposed to, they do tend to be very focused on kind of like global issues, whereas I feel like older folks, because they're always on their phones, they're on social media, they have this beautiful sort of like global awareness. But I find that for the most part, older folks are a lot more in tune on local issues or, kind of like, local history. So definitely bridging that gap. I'm all about intergenerational love and community.
100%. We got time for one or two final thoughts, questions, reflections. Anybody, feel free to jump in.
I just like seeing the diverse ways that we all kind of are advocating for our different causes. I think it kind of reignited some of my curiosity on like getting involved in different spaces. Obviously, we're doing great jobs in our own spaces, but it was nice to see how everyone was doing their own thing for the same cause of getting people involved and getting better outcomes for our community.
100%. And I think that's a part of the purpose today was not only to educate, but to create a space where we can convene and create a spirit of collaboration, because it's with what's in front of us, it's going to take all of us here in the room and many more. So we got our work cut out for us, but hopefully folks leave today inspired. And I encourage you all to look at any of the folks in the room and build those connections on LinkedIn, and let's continue this work outside of this webinar today. So with that, I want to close us out timely. I'd like to once again thank all of our panelists, everybody who joined, all of our participants for spending this time with us this evening. You could have been a lot of places, but to take an evening and spend this time with us we're extremely appreciative. I want to encourage you all to continue this conversation outside of today, right? And help folks in your communities, in your households, understand that the choices that we make at the ballot box shape the policies that impact our everyday lives. And whether that is from, as we're talking about healthcare access, clean air and water, environmental justice, healthy neighborhoods, the list goes on, right? Every single one of those aspects is directly impacted by our vote. And so make sure that you're registered and you have a plan to vote. Again, encourage those family members and friends to vote. Volunteer as a poll worker or election volunteer. I know Ms. Kroom has been a champion in that space for here at the local level here in Grand Rapids. Stay engaged with your local elected officials, and not just before election, but I think what's most important is the accountability that has to happen after folks are in those seats, right? And continue to advocate for healthier, more equitable communities. Lastly, I just want to encourage you all to stay connected with all the partners who put on today's webinar to help organize this. I want to give huge thanks to Teresa Hamzi with Michigan Clinicians for Climate Action. Big thanks to the Cancer Free Economy Network. You see all those links here. We'll also send follow-up resources to everybody who joined today, and as well as the NAACP Greater Grand Rapids chapter. And last but not least, huge thanks to Dr. Asia Harris, Mary Jacqueline Mully, and Commissioner Nancy Morales for taking the time to be here and share your expertise and insights. And so that's my closing remarks. I'll pass it over to Teresa to see if you have anything else to share before we call it to a close today.
Yeah, I think that you wrapped it up beautifully there. Kareem, thanks so much for being part of this and co-organizing. And I know we had a small group today, but we'll be posting this online, and a lot of y'all had some really good mic drops. So we're gonna clip them and we're gonna proliferate them, because I think the idea behind this was, obviously everyone on the call is already engaged. And so, I know there's some comments about, what's the value of preaching to the choir, right? I do think the choir needs to practice. So sometimes preaching to the choir isn't a bad thing. There's that. But also too, I think, a lot of us are surrounded by some cynicism, about, what's the point? I feel like there's a general kind of nihilistic attitude, at least that I encounter. And I know that's something that you kind of alluded to with the youth engagement piece. So I really appreciated how all the speakers here today really made the stakes human, and I was taking notes about how I can talk to people who are disengaged and disenchanted. I think asking people what issues they care about is, step one, but then bringing in, Dr. Harris, you kind of expanded my worldview with just like even thinking about, what kind of equipment that you have in a healthcare facility, that's all of that is policy. And then, Nancy, going beyond that, the pump valve, Mary Jacqueline, in your neighborhood, in your house to address sewage backflow. I mean, these are real things. And that point too about global versus local. Nancy, I know you said that's from your experience with young people, but yeah, maybe they are thinking a little bit too globally. And I think bringing in the local, making this personal is really important. So I know that everyone here hopefully feels more prepared to engage with people who might feel like they haven't been represented, and all the more reason for them to show up, not just to this upcoming midterm, but to President Jackson's point, beyond then. So thank you so much for your time. We'll be posting this online and following up with some of these resources.
All right. And with that, we'll close out this evening. Thank you all again for joining us, and stay tuned. I think this was a great conversation and may warrant a part two. So stay tuned for more, and have a great evening, everyone.
Thank you, everybody.
All right, thank you.
Thanks, everyone.
Thank you.
Have a good evening.
Amazing. Good night.
Yeah,
Good night.
thank you. Good night.